Thyroid RAI Treatment, Understanding Radiation Safety. Radioactive iodine therapy is a common treatment for hyperthyroidism and certain types of thyroid cancer. This treatment uses iodine-131, a radioactive form of iodine, to target and destroy overactive or cancerous thyroid cells. Since this therapy involves radiation, understanding safety measures is crucial for patients and their families. After receiving radioactive iodine, patients will emit radiation for a period of time. To protect others, especially vulnerable groups like pregnant women, infants, and pets, patients should follow specific safety precautions. It is recommended to maintain physical distance from others for several days to weeks, depending on the dose received. Close contact, such as hugging or kissing, should be avoided during this time. Practicing good hygiene is also important. Patients should wash their hands frequently and use separate utensils and towels to prevent contamination from bodily fluids. Sleeping alone and avoiding crowded places or public transportation for a short period after treatment can further minimize radiation exposure to others. Before being discharged from the hospital, healthcare providers often measure patients' radiation levels to ensure they are below safety limits. This monitoring helps confirm that patients can safely return home. The levels of radiation decrease quickly as the radioactive iodine is eliminated from the body. Certain populations requiring extra precautions. For instance, radioactive iodine can cross the placenta, making it unsafe for pregnant women. Therefore, women are advised to avoid pregnancy for at least 6 to 12 months after treatment. Breastfeeding is also discouraged, as radioactive iodine can be passed through breast milk, potentially exposing nursing infants. Children are particularly sensitive to radiation, so extra care is needed to limit their exposure from treated patients. Long-term safety is also a consideration. Most patients will need lifelong thyroid hormone replacement therapy after radioactive iodine treatment due to the destruction of thyroid tissue. While the risk of developing secondary cancers from this treatment is very low, it is still a factor that healthcare providers consider in treatment planning. Radiation safety practices for radioactive iodine therapy follow guidelines from nuclear regulatory bodies and professional organizations. These guidelines include recommendations for patient education, exposure limits, and duration of precautions tailored to individual treatment doses. In summary, understanding radiation safety in thyroid radioactive iodine treatment involves managing exposure risks through education, temporary behavioral changes, and monitoring radiation levels. Special considerations for vulnerable groups are essential. By adhering to these safety measures, patients can ensure effective treatment while minimizing radiation risks to others. Always consult with healthcare providers for personalized advice and follow their instructions regarding radiation safety.